Hi, welcome. I'm Dr Khaled Sadek and you're watching my fantastic YouTube channel on cysts and lipoma removal. We've got something really exciting today. What I'm going to do is something new. What I'm thinking of doing is commenting on the comments. That's right, I'm going to pull out a whole bunch of comments that I've had over the series and then reply to them one by one. Let's see how it goes. We also will be trying something really funky. While we're talking about the comments, we'll also put up here or up here a little video running at the same time of what the surgery and the comment relate to. So let's kick off with comment number one is, do cysts smell? We get this a lot. Do cysts smell? Well, here is the simple answer that you were looking for. An infected cyst certainly can smell because the bacteria breaks into that sac of sebum, which is a rich oil, and starts to grow, and its byproduct is an offensive discharge of nitrate, which causes the smell. So yes, cysts do smell if they get infected. Okay, next question up. Do you prescribe antibiotics for your patients? Typically, the answer is no. We don't routinely give antibiotics to patients who've had surgery, and even in cases where it does appear to be infected, often draining the cyst and packing it with a silver impregnated ribbon will be enough. In some cases where there's evidence of cellulitis, that's infection spreading into the skin, then yes, we would do antibiotics. Next question. Brits, don't get excited. Well, I think this comment relates to some of the patients and their partners who come in together and how much enthusiasm they show to watching the procedure itself. We've certainly had a couple of couples come in, they've been very excited to watch their partners undergo surgery. And actually, one of the comments relates to this. Husband and wife popoholics are always great fun to have in theatre because they've got good chat and they really appreciate what we're doing. Cut open what you remove. Now, we get a lot of comments about patients who say, why don't we cut up what we remove on camera? And we're going to take this message on board, and going forward, we hope to show you a lot more of what's actually inside the sac. So we open it up and show it to you live on camera. Are infected cysts harder to remove? Well, potentially yes, because what happens is that firmness you get with a non-infected cyst liquefies, and as a result the sac breaks down and it's very difficult to then go around and muck up all the pieces of sprayed sac everywhere. I like to sometimes describe this as blowing a balloon and then filling it with Gillette shaving foam, and then you hold it in your hand, and that is basically a sebaceous cyst. But when the infection gets in, that's like getting a pin and puncturing that balloon and letting all that mess go everywhere, and then having to go around, chase up the rubber pieces, which is the remains of the sac, the liquefied, putrid discharge that results. Not nice. Next up, hand stitches. Why do we hand stitch as opposed to instrumental stitches? Because I prefer it. I find it a little bit more precise, a lot quicker, and it gets good hemostatic result. That means it gets good blood control. A lot of our pictures, very little blood discharge because we use a little bit of xylocaine and adrenaline, or epinephrine as you might call it in the States, and that helps to reduce any bleeding. So up here we'll show you a little clip of the hand tying stitches themselves going down there. Hope you enjoy that. Next question. I want a t-shirt with your name. Well, that's very, very kind. We don't have any merchandise, but that's something we might consider doing. Let me know your thoughts about it. If you want it, you don't want it, maybe some surgical caps, gown, Dr Sadek, surgical scrub, whatever you want, we can facilitate. Next question. People love the tours of London. I think the tours of London are one of the unique points that we do as part of our popoholic video filming, along with the wave. I think these are very signature pieces for what we do, and certainly we'll be doing a lot more of those outdoor films, as well as incorporating some other stuff. So keep watching, lots to do. Reverse filming is disgusting. Please don't do it again. Okay, a lot of people did not enjoy the reverse filming of ruptured cysts, so we probably won't show that again. Or maybe we will. Next question. What is the size of your surgical blade? I think we use a surgical blade size 11, and it gives us a very precise cut. It's a very thin blade, not much of a belly, because there isn't a huge amount of skin that needs to be cut. We're doing very, very small incisions, often 1 centimeter, maybe 2 centimeters at the most, and then dissecting deep down through the tissue layers until we get to that cyst, and then we rip it out, make sure it doesn't come back. Pull out. Do we use scissors to dissect or not? Well, a lot of my surgery, it actually involves blunt dissection. Once I've got through the skin layer, I tend not to use the surgical blade afterwards, and I just use the instruments to just separate the fascia, the different layers of tissue. I find that gives much better blood control, better scar and healing, and it has much more respect for tissue handling, which I think is really, really important when it comes to doing surgical procedure. Dr. K, it's like we just walked in on him. Yeah, I love the cheesy intros. I'm not going to stop them. More cheesy intros to come. And the real surprise on my face when I find you all there looking at me going, oh, he's making a cup of tea. What's he doing? It's Dr. K. All right, next question. How do I know that the shake is a pimple popper? I don't, but I think he must be, surely. Everyone's a pimple popper, right? I mean, even the shake's a pimple popper, surely. Next question. I had to duck when it exploded. Actually, we get that a lot. There's a lot of real popping out gungy stuff that happens all the time, and you've got to be careful because it can look like it's literally going to jump out at you. So yeah, be careful. Ooh, there's another one. So next question. Do we wash out? I know that in the States it's very popular to wash out with a peroxide type material or liquid. We tend not to do it here in the United Kingdom. It's good enough to just clean it out, you know, make sure that there's nothing left behind. There's no real need to irrigate it with a special solution. These are very superficial cysts, and there's no need for that. Okay, cut that out, stop doing it. Next question. Your name appears as Colored Snake in the captions. Okay. I think there might be some sort of audio translation thing that comes on because we don't type out the translation at the bottom. It does that automatically. So yeah, my name's not Dr. Khaled Sadek. It's Dr. Khaled Sadek. Khaled Snake. What the fuck is that? I'm the only one who responds to fans. You know what? I had a look at all the other big pimple poppers in the pimple popping world, and you're right, very few of them do respond to fans. I actually personally read every single message, and really are really humbled and really encouraged by the level of support we get for the work we do, and we listen to everything you say. So I know a lot of people didn't like the angle of some of the footages, and you want the camera moved around, so we'll do that. You want to see the opening of the sac, we'll do that. You want merchandise, we'll do that. Anything you want, we'll do it with extra fries and a large drink as well. Next question. Where is the bell? I don't know where the bell is. There's like this bell shape, like a Taco Bell thing. You got to press it, because you don't press it, you don't get to know that we have released a brand new video. And it's really important that you like, you comment, you share, you subscribe, because that drives the momentum to produce more. It's really important for us to know that you like what we do, and we do that through the feedback we get. So yeah, press the bell and the like and all those other things. All those things, do it. Do it now, actually. Hope you've enjoyed our comments and response section. Remember to subscribe, like, share, press the alert button, comment down below. Watch some of our great videos. I'll put some links up now for you to go and watch some of our great hitters over the last sort of 6 months. And most importantly, keep supporting and enjoy the show. Till next time, bye bye.